one of the most important thing that you deal with is spine.
Yes.
Okay. And I really want you to explain to our audience in detail regarding the anatomy of the spine. So what is the cervical spine and what is the thoracic spine, the C7, T12, lumbar and the sacrococcygeum, so that they can understand the spine is not a vertical thing like this.
Yeah.
And all these curves, there's a reason there is a curve.
Yeah.
So can you educate us, please?
So the spine is this crucial, very important stack of bones in the back of the body, and basically supports the head and the rest of the body lower down. So the cervical spine, basically 7 cervical vertebrae. C1, we have numbered them from C1 to C7, very unimaginatively numbered, but that's how it is. Then we have thoracic 1 to thoracic 12. And then lumbar 1 to lumbar 5. And then sacrum is one solid piece of bone, 5 vertebrae. And then you have the coccyx. The cervical vertebrae, the first 2 vertebrae are atypical cervical vertebrae. They are not the normal shape and function like the other cervical vertebrae. So C1 is a ring which is attached to the bottom of the skull. And C2 is a vertebrae with a peg that goes through that ring. And this is what enables you to rotate your neck. So that is the C1, C2 joint, which allows that rotation to take place. That's a very important joint because often we get diseases in that C1, C2, very complex diseases, and things like atlantoaxial dislocation, basilar invagination, which are difficult to treat sometimes. And they can lead to quite a lot of morbidity and mortality also in some cases. Then we come down the rest of the cervical spine. The cervical spine has a curve facing forwards, which is called a lordosis, which is similar to what the lumbar spine has. That is important because it maintains the overall balance of the person when they are standing. So we call that, when you look at a person from the side, we call that sagittal balance in the sagittal plane. So if your cervical curve or your lumbar curve or thoracic curve goes out of whack, then your sagittal balance will get disturbed. So you'll tend to fall forward or fall backward. Then you have to compensate by rotating your hips.
I see.
So that to maintain your balance. So it's very important that the lordosis of the cervical and the lumbar spine is maintained as much as possible.
The curve is maintained.
Yes. And thoracic spine has an opposite curve, which is a normal thoracic kyphosis. So thoracic spine starts from T1 and ends at T12. They're very different.
That's your mid-back.
Mid-back. Basically behind the chest.
Behind the chest.
So T1 is very different from T12. T1 resembles mostly the cervical vertebrae. T12 resembles more of the lumbar vertebrae. And the junction between C7 and T1 and T12 and L1 is the transitional zone, the junctional zone. And that's a very important part of the spine. Biomechanically very important because movement is happening at C7 but not at T1. So, the stresses on that segment are different. Now, a lot of the problems in the spine happen because of the discs.
Correct.
So, in between the vertebrae, in the front of the spinal cord, you have these discs, which they're called syndesmosis, is the correct name for them. They're syndesmotic joints. And behind the spinal cord, you have these other joints where one vertebrae is connected to the other by these things called facet joints, which allow some movement of the spine, this movement, bending forward, backwards, and a little bit of rotation also. The thoracic spine is relatively immobile because the ribs are attached to it. So the ribs go around and they go and get attached to the thoracic spine. And let's consider the thoracic spine is relatively immobile and quite stable and fixed because of the external support of the ribs. Then we come to the lumbar spine, which is again a very flexible part of the spine. And unfortunately for us as human beings, the lumbar spine is not well adapted to the upright posture. So the lumbar spine, as you can see, has no support.
There is nothing in the pelvis area.
Nothing. And it's a freestanding part of the spine between the thorax and the pelvis, which are both relatively fixed points. And it ends up becoming a site of a lot of the degeneration that we come across.